I'd like to welcome all of you to the Baker Institute for Public Policy. We are a nonpartisan, fact-based public policy institute. We research, we analyze, and we write on topics of interest with potential impact for Houston, for Texas, United States, and the global community. I'm very pleased today to announce we've expanded the scope of our work in our Center for Health Policy to include more dedicated attention to maternal and reproductive health. These are both critical issues in the U.S., and they're absolutely critical issues here in Texas. Texas is home to over 6 million women of childbearing age whose ability to plan their pregnancies by accessing reproductive health care, including contraception, is impacted by policy decisions, as they are outside Texas. Because this state has the highest rate and the highest number of uninsured persons in the United States, many Texas women are challenged when trying to access affordable contraception. This is especially challenging for teens, as you'll hear today from our speakers. And the Center for Health Policy is delighted to have brought on 3 researchers with deep expertise in this area to help us expand our program. They are Dr. Carrie White, who you'll hear from today, and Drs. Anna Chatillon and Gracia, to study the impact of policy decisions on Texas women's access to reproductive health care. Today we'll be talking about how teens can access contraception in Texas, to be followed by additional reports and events to highlight policy opportunities for improving women's health outcomes. Today's session will be moderated by our Senior Fellow in Health Policy, Elena Marks. Our primary speaker will be Dr. Carrie White, a fellow here at the Baker Institute. Dr. White has over 15 years' experience conducting high-impact, policy-relevant research on how policy changes affect people's reproductive health care outcomes. Her research has been published in the New England Journal of Medicine and JAMA, among others. Dr. White serves currently as the Executive and Scientific Director at Resound Research for Reproductive Health. Previously, she was a professor at UT Austin. Joining Dr. White will be Dr. Meghna Raval, a professor at Baylor College of Medicine. She provides medical care for teens and young adults at Texas Children's Hospital and the Baylor Teen Health Clinic, where she is the medical director. Her focus is on adolescent medicine. And our third panelist was Akech Osamba, who serves as the Direct Services Program Manager at Jane's Due Process. Now, that organization helps young people in Texas navigate parental consent laws and abortion bans to confidentially access reproductive health services, including contraception. And we will be joined by Texas State Senator Molly Cook. Senator Cook is a 6th-generation Texan, born and raised in Houston. She's also an emergency room nurse with deep knowledge in the healthcare space. She is co-sponsor of a bill relating to teen access to confidential services, which we will be discussing today. We're grateful for you all taking the time to join us during this eventful, for Texas, still ongoing legislative session. Please welcome our panelists and our moderator. Thank you all for coming. Over to you, Elena.
All right, thanks. So we've got a really great program today. We're going to start out with Dr. Carrie White, who's done a ton of research in the area of reproductive health, and specifically regarding teens and access to contraception. And she's just published a paper through the Baker Institute that lays out a lot of this research. And so she's going to take you through what her research has shown. And then we're going to move over and talk to people who are actually on the ground doing this work. We're going to hear from Meghna about what it's like to take care of teens who are sexually active and want to have access to contraception so that they can keep themselves safe, and the opportunities and challenges of serving that population. And then we're going to hear from Akech, who's going to talk about how teens are trying to navigate an increasingly hostile landscape to getting the kind of reproductive health services they need, specifically around contraception in Texas today. And then we are going to have, at some point, Senator Molly Cook is going to jump in here, and she's going to talk to us. She's actually on the floor right now, but apparently getting off. And she's the author of a couple of bills that are trying to change the trajectory for teens in Texas so that they can get access to confidential services that right now they really don't have the opportunity to get. And so with that, I think we're going to move to Carrie and let you take us through your data, and we'll go from there.
Okay, sounds good.
And we have Q&A at the end, so be thinking of your questions, and because we really want to be able to give you information that you're interested in, so start writing them down.
Okay. Well, thanks everybody for joining us at the end of your day, and for everybody joining us virtually. So I'm going to start us off. Is this, are we ready to go with the slides? Oh, yep, sorry, backwards. I can't see them. Maybe I do need to see them. Yeah, I think it'll be helpful if I just see what I'm supposed to be talking about first. Okay, so I'm just going to give you an overview of what some of the recommendations are for young people getting access to contraception, and what some of the evidence is about when teens have access to confidential contraceptive care and when they don't. So first of all, professional medical associations, including the American Academy of Pediatrics, the Society of Adolescent Health and Medicine, and the American College of Obstetricians and Gynecologists, among others, recommend that teens have access to confidential care. And one of the reasons for this is because it really provides them with an opportunity to have more open communication around sensitive topics like being sexually active and getting and using contraception. When teens have access to confidential care, they're more and confidential contraceptive care, they're more likely to use effective methods of contraception. And when teens face barriers to getting confidential care, they're less likely to use effective methods and more likely to find themselves pregnant before they are ready and even contract sexually transmitted infections. Another reason why professional medical associations recommend teens get confidential care is because it really helps further adolescents along in their development and beginning to make some of their own decisions about their reproductive health care, which they'll do as they age into adulthood. In addition to recommending confidential care, these professional medical associations recommend that contraceptive care be available at low or no cost because young people don't have a lot of financial resources, and so they need some financial help to be able to get these services. So what does the landscape look like here in Texas? Well, first of all, let's just look at what insurance coverage minors may or may not have access to. Most young people in Texas under the age of 18 do have some form of health care coverage. About half are covered by private insurance plans, and a little over a third are covered by Medicaid or another public program. About 1% are enrolled in the Children's Health Insurance Program, and while this number has decreased over the last several years, given the size of Texas, it's still a pretty large number of young people. About 72,000 young people are enrolled in this program. And then 12% of children in Texas under the age of 18 lack health care coverage. This is the highest percentage of any state in the US. So what does this insurance coverage mean for contraceptive access? Well, as a result of the Affordable Care Act, private insurance plans are required to cover FDA-approved contraceptive methods. So young people who have private insurance coverage can get contraceptive through their insurance plan. Contraceptive coverage is also required as part of Medicaid. But in the CHIP program in Texas, this program does not cover contraception. And in fact, Texas is one of 2 states in the US, the other being North Dakota, that does not include contraceptive coverage in its CHIP program. So for children who are enrolled in CHIP, or for those who lack health insurance entirely, the way that they can get access to contraception, especially highly effective methods like oral contraceptive pills, contraceptive implants or injections or intrauterine devices, is through going to health centers that have state or federal funding, or both types of funding. But it's a little bit more complicated than that still. What you can see on this map is that there's a lot of variation across states in the US in terms of whether or not they require or allow, I guess I could say, minors to consent for contraception on their own. So in 23 US states, those that are shaded in the darker green here, those are states where minors can consent for contraception by themselves, or there's no explicit state policy about it. In 5 additional states, Hawaii, Alabama, South Carolina, Pennsylvania, and Delaware, minors who are of a certain age can consent to contraception. So that's usually 12 to 16 years of age, depending on the state. And then these other states that are colored in gray, minors can only consent to contraceptive care under very limited circumstances. In some states, a minor must meet the state statute for being considered a mature minor. In other states, a minor must already be a parent to a young child. But in Texas, it's even narrower still. And minors can only consent to their own contraceptive care if they are legally emancipated from their parent or if they are married. So let's look at this a different way. What this means is that in Texas, minors cannot obtain clinician-provided methods of contraception, the most highly effective methods like oral contraceptive pills, contraceptive injections, contraceptive implants, without parental consent. But they can go over the counter and buy emergency contraceptive pills, condoms, or the new oral contraceptive pill, the O pill, if they're able to afford it. They can get contraceptive counseling without parental involvement. They can get testing and treatment for sexually transmitted infections without parental involvement. And they can get pregnancy tests without parental involvement. They just can't get the most highly effective methods for preventing pregnancy. The one avenue that people under the age of 18 in Texas had to access contraceptive care without parental involvement was the federal Title X program. The Title X program was established in 1970 under the Nixon administration, and it was sponsored by then Texas Senator George H.W. Bush. This program was intended to provide funding to health centers across the United States to make sure that sexual and reproductive health care was available to anybody regardless of their socioeconomic status. One of the tenets of this program was that health centers, while they could encourage parents to be involved in a young person's contraceptive care, parental consent was not required. And the program required services to be available for anyone confidentially. So this not only applied to minors, but this also applied to survivors of intimate personal violence who might need confidential care. But up until several years ago, minors could access these Title X health centers, of which there were over 150 in Texas. You can see here on this map. They were able to get confidential care at these health centers until the end of 2022. At that point, a federal district court judge in Amarillo, Judge Matthew Kaczmarek, ruled in a case Deanda versus Becerra that the Title X program violated Texas's law and parents' rights. And as a result, in January of 2023, all Title X funded health centers in Texas had to require parental consent for teens getting getting contraceptive care. So there is now no options for teens to get confidential reproductive health care or confidential birth control methods for these really highly effective methods in Texas. But this doesn't mean that teens in Texas aren't sexually active. According to the 2023 Youth Risk Behavioral Survey, 1 in 5 Texas high school students report that they're sexually active. And the percentage of students who are sexually active, not surprisingly perhaps, increases as high school students get older. So just 10% who were 15 years of age or younger are sexually active. And by the time you get to be later in high school, it's about half of high school students are sexually active. Among sexually active students, about 27% are using the most effective methods of contraception. Again, oral contraceptive pills, contraceptive injections or implants, or intrauterine devices. More commonly, however, teens are using condoms when they have sex, and 16% of teens reported that they were using no method of contraception the last time they had sex. So is this unusual for Texas? Like, is this the norm, or does this look like high school students everywhere in the US? So let's just take a couple states for comparison. Colorado and Georgia, states that have similar demographic composition. Both of those states do not require parental consent for contraception. And what you can see, this is a little bit older data because their 2023 data wasn't available yet. But in these states, the percentage of high school students who are sexually active is pretty similar. But we see big differences in the percentage of students who are using highly effective methods when they have sex in Colorado and Georgia compared to Texas. And you see a higher percentage of Texas high school students not using a method of contraception compared to these other states. Again, it's not surprising then that we see higher birth rates among Texas teens compared to the US overall. Birth rates among teens in the US has been declining over the last several years, but the teen birth rate in Texas is about twice as high as that of the US national average. And Texas has the 8th highest teen birth rate in the country and the 3rd highest repeat teen birth rate. Looking again at these comparison states, you can see that, again, Texas is higher, has a higher teen birth rate than in other states where parental consent for contraception is not required. Now, there are a lot of other reasons that go into this, but this is, again, I think a notable difference between Texas and some of these other places. And we know from some of our research that teens want to prevent pregnancy. They want to use highly effective methods of contraception, but they run into barriers when it comes to parental consent. So several years ago, our team collaborated on a research project with the staff at Jane's Due Process, who you'll hear from in a little bit, where we interviewed teens who had reached out to Jane's Due Process seeking information about how to get contraception without their parent being involved. And what we heard time and time again in these interviews is that young people wanted to prevent pregnancy, they wanted highly effective methods, and they were stuck trying to get them. An example, in one case, we'll call this participant Alexis. She was 16 years old, and she said, "I've been doing research on condoms, and I know that they're not the most reliable. I hate to think that anybody that I would be with would do this, but I know that some guys can mess with condoms and so that they might not work right. And so I felt the need to take it upon myself to try to take the extra step just for my own safety." And she went on to add, "I also have really bad periods, and I had done some research, and birth control can also help with that. And so it's both of those things why she wanted contraception." Alexa had tried to talk to her parents, but didn't get very far in those conversations. And so she instead turned to her aunt and uncle, who referred her to Jane's Due Process for more resources and information. Sometimes when teens like Alexis, when they talk to their parents, they run into other problems. Olivia, we'll call her, was 17 years old, and she had decided that, using withdrawal and occasionally emergency contraception with her boyfriend was not enough. It was making her very anxious about the possibility that she might get pregnant. And so she went to her mom and asked her about trying to get contraception. And she said, "My mom was shutting it down, saying how it was unnatural, so that's why I can't go to her about any of these questions." When she started describing contraception, it was a lot of misinformation. And she kept bringing up God and how contraception disrupts your body and it ruins it. And I don't want my parents to find out, but I don't think I can handle a pregnancy at this age. So she knew she wasn't ready to be pregnant. She was proactively trying to bring up this conversation with her parents, but her mother just didn't have the right information to point her in the direction that she wanted to go. And one of the youngest participants that we talked with, Ashley, who is 15, she had a grandmother who she was living with, who was supportive of her starting contraception and said that whenever she started to become sexually active, she should go to her grandmother so that she can get on oral contraceptives. When Ashley finally did become sexually active, she didn't think that her grandmother would approve of her boyfriend because he was of a different racial background. So she didn't feel like she could have this conversation, and instead was looking for another place to get effective methods. And while she was one of our youngest participants, she had a really poignant comment saying, "I think that birth control should be accessible to everyone, regardless of their age. As long as you know you're trying to protect yourself and there's no need for parents to be involved, especially if you have a doctor who's looking over the whole thing." So just to close, there are a lot of obstacles in the way of young people getting access to confidential contraception in Texas. I think it's also important to point out that over the last 10 years, there have been bills filed in every single legislative session trying to change that, trying to move the needle to make Texas's policies more aligned with Professional Medical Association's recommendations. In this session, there is a bill that has been filed that would allow any minor to consent for contraception, and some other bills that are trying to address the contraceptive coverage gaps for teens enrolled in the CHIP program. And we can hear a little bit more about that later on in the panel today. But I'll just wrap up here, and we can turn the conversation over to our other panelists who can talk about serving teens on the ground.
Yeah. Okay. Yes, we're going to go out of order. Senator Molly Cook is joining us and asked if we could bump her. She's stepped out of a session, so we're really grateful for her participation. So we're going to go on and hear from the senator and take it from there. AV people. Can you see us? Oh, there you are. Thank you so much.
Can you all hear me okay?
Yeah, thank you so much for being with us. I don't know if you heard Carrie's presentation. We're talking about, how teens can protect themselves and what the legislature can do to make it more realistic. So thanks, and take it away. What are your thoughts?
Well, thank you so much for having me, and thank you so much for having this important conversation. For y'all who don't know me, I'm an emergency room nurse, and so this intersection of policy and healthcare is just the most important thing that we work on in the state legislature. And for my office, we view every single bill as a health bill. So I'm very proud to be co-authored on one of the bills that the former presenter mentioned, which is SB 348, which just simply says that if you've already had a child, you're already a mother, already a parent, then you would be able to consent to receive contraception or consent to that exam. It's something that just seems so simple. And I think you phrased it really well, the things that our legislature can be doing to help folks access the care that they need, the contraception that they need. But sometimes in Texas, I think it's more about the legislature moving out of the way and stopping doing anything. Because they are always continuing to try to roll back our access to the healthcare that frankly we have a right to as humans, but certainly as the wealthiest state and the wealthiest nation that this world has ever known. And I think what a lot of folks don't realize about healthcare is that, we've arrived at a lot of these ethics and a lot of these structures over time for a reason. And so there is a difference in healthcare between someone who's 0 to 7, someone who's 7 to 14, and somebody who is 14 and older. And we call it the rule of sevens. And it's very typical that a child with a terminal diagnosis or a child who's dealing with something really adult can be treated a little bit differently. And so there's just so much precedent there. There's so much that we do in the emergency room, in the exam space that we almost take for granted that our state can take away from us. And so I'm just so grateful y'all are having this conversation, especially in a state with this many poor outcomes for mothers and parents and for babies, in a state with such a high teen pregnancy rate and such a high rate of repeated teen pregnancies, which we know are kind of the way that folks get caught up in a cycle where they can't ever quite get ahead. Is that once you give birth to one baby, if your state is not there to support you and make sure that that's a full success, then you can run into issues, accidentally get pregnant again and be in the same situation, in the same climate where you're not in control of your own body, you're not in your control of your own healthcare, and frankly, neither is your doctor. So thank you all so much for talking about this today, for protecting that doctor-patient relationship, and for bringing up some of these important bills that folks can reach out to their legislators about. The last thing that I will say to this room, and especially as a brand new Texas State Senator, I was sworn in 11 months ago, And so just a year ago, I was also sitting in that public comment seat, right? And on the hot mic and talking to the folks who are making the decisions about my life. I have been so overwhelmed with how powerful comments are in committee. Truly, you watch people's faces change, you watch people kind of think differently about their bills, you hear people go from being defensive to saying, well, our office would love to work with you on that. And I can tell y'all that I have sat through now multiple Health and Human Services committee hearings and been in my opinion, I'll just say this straight to y'all, the only voice of reason on things as sensitive and important as contraception and other types of important healthcare decisions. And so I just encourage people, if you've got the privilege, if you've got the time, and you can make it to Austin for one day of the session, pick a day when there's a Health and Human Services committee meeting, and I promise you, you will find bills that you want to give comments on. And I think people should just be really empowered to organize their neighborhood, organize their street, organize their PTA, organize your church group, whatever it is, and show up to the Capitol and come in and say what you really feel on the microphone about how these things could be what the data shows and what a truly healthy Texas looks like. And I promise you, it does make a difference. So I just want to encourage y'all, be empowered. Thank you so much for talking about these important issues. And thank you for allowing me to come and speak to y'all as well.
Thank you so much for being with us. Appreciate your work in Austin, and good luck in the rest of the session.
Thank you so much.
All right, Doctor, you're up. What's it like in the actual field working with adolescents?
Thank you very much for inviting me and allowing me to share some of my experiences as an adolescent medicine provider. So, as was mentioned earlier, I work in two settings at Texas Children's Hospital as well as the Baylor Teen Health Clinics. And, I wanted to start off by just explaining a little bit more about what these settings look like. So specifically at the teen clinics, we provide free services to 13 to 24-year-olds. And most of our youth are either uninsured or underinsured. So I know Carrie pointed out her slide with, what proportion of Texas minors have coverage through various types of insurance. And most of our youth fall in that last category of the funding coming through various state sources. Majority are below federal poverty limits, and majority belong to minority racial and ethnic groups. We primarily see young women. About 80% of our population is female identifying. And if you look at our demographics, we see about 8,000, 10,000 13 to 24-year-olds every year, and about 1,700, 1,800 are minors, and about 30% of them come in for birth control. The rest come in for lots of other things like vaccines and sports physicals and just their well exams, and there's a healthy mixture of all of that. Now, having said that, I work primarily at the school clinics, and I think that's my favorite setting to work at because I get to see young people in the setting that they spend the most time in. In fact, just this morning, I was at one of the schools and I was telling Carrie about this, but this morning I had a young person who was telling me that my favorite question to ask is, what are you going to do next? And this person was like, oh, I want to go to the military. And then the next person was like, I want to join nursing school. And then the one after that was like, I got a full ride to go to UH to study computer science. And I say this because, these young people are navigating so many complex, aspects of their life, right? And their healthcare is such an important step to us helping them make sure that they achieve some of those goals that they've set out for themselves. And this includes reproductive health care like birth control access. So I told you that in our clinic, our youth are primarily state funded. So for us, the way we provide birth control to youth is that we do require parental consent. So this means that every student in the school gets a registration packet that includes a consent form for our clinic, and it specifically mentions that our clinic provides all these other health services. We provide mental health care as well, And then there's a separate clause that says, where the parent can say, yes or no, I consent to my minor patient to pick a method of prescription birth control. And some parents say yes. In fact, for a lot of young people, parents are a really important part of this decision-making process. And, as a provider, that's something that we encourage for all our youth. But then there is that, fair number of young people for whom they say no, and then we are in this situation wherein a young person is just like Carrie mentioned, they want to access reliable methods of birth control, but they aren't able to do so because of a discrepancy between their desire and that of their parent. In fact, a few months ago, I distinctly recall the story of a girl who was 17 and a half, right? So she's like, almost 18, nearly a young adult, right, due for her depot shot, and her mom had previously said yes to allowing birth control and then signed a new consent form in which she said no. And we were in the situation of, well, you're due for depot shot, but what can I do? You're not 18 just yet, right? So we do have to wait, or we have to figure out a way to navigate this conversation with your mom so as to allow you to get this method of birth control that had already worked for you and worked well for you. In our clinics, our population is, I told you we are in some school settings. And, we looked at our school students, and, Carrie had mentioned about 1 in 5 Texas high school students are sexually active. But when we looked at our students, about 300 of them, over 50% of them were sexually active. And, I said 1,700 minors come to our clinic, about 500 of them are on birth control methods. Fair amount of them, that's not 50%, right? And I already told you, like 90% of our population is female. So, that does indicate that there's a gap. Teen pregnancy certainly has real life consequences for women, right? And Carrie mentioned that repeat pregnancy rates are higher in teen parents. Also, the risk of postpartum depression is another thing that comes up for youth who come back to us. And they experience depression differently, so they tend to have longer lasting symptoms. They tend to be at higher risk for intimate partner violence. And then children of teen parents are also at risk for poorer outcomes, so lower birth weight and preterm birth as well. These are some of the things that I am seeing in my clinical setting. I think, we have been trying to really leverage some of the over-the-counter options when that's possible. So whether that be Opal or, access to barrier methods, which are certainly not as effective but better than nothing, or emergency contraception when that's applicable. So just a little summary of the things that I'm seeing.
Anna Catch, tell us what you're hearing. You talk to teens across the state every day.
Yeah, that's definitely something that I can speak to. So for anyone that's not familiar, I work with Jane's Due Process. We're an organization that started in 2001 following one of the first parental involvement laws in Texas surrounding birth control and abortion access. Since then, we've branched into a variety of services that cover young people's reproductive health decision-making. One of those services being our phone hotline and text line. And in doing so, young people can reach out to us and they can ask questions that they may have regarding their sexual being, their reproductive health care, and that can kind of look like them asking about what are some of their clinic options near them, where can they access birth control, and then how can they access some of our other services, which I'll get into a little later. One of the things that I have found very interesting in my time, whether I was volunteering with JDP or now working full-time with Jane's Due Process, is seeing how almost like a marker, right? Each of these policy changes has led to a shift in how people access us and what they're accessing us for. So prior to the DeAnda case that Carrie was mentioning earlier, we did have a lot of young people who were reaching out to us. They were asking for birth control. And a lot of times the conversation on our end, anyone that's reaching out to us has to text us first. We don't see any phone numbers, right? So it is an anonymous way for them to ask the questions that they're really needing answers to. And those conversations will literally look like, hey, I'm in Houston and I want to know where I can access birth control, right? That to me indicates someone knows what they're looking for. They just need help connecting the dots. So prior to the DeAnda decision, we were able to get their zip code, find the nearest clinic to them, and kind of help guide them through what that process may look like for them to get free to low cost birth control options. Following the DeAnda decision, where minors could no longer access Title X clinics without parental consent, the conversations look a little different, right? So now we're still getting the same direct, hey, how can I get birth control? Where can I get Plan B? But the way we're having to navigate those conversations does look different now that there are more barriers in place for young people. One thing that I often keep in mind when working with young people is there are obviously barriers in accessing healthcare for anyone. Those barriers tend to be exacerbated when we're dealing with young people, right? Think, do you have a car, right? Do you have a means to get to the appointment? Do you even have the means to pay for the appointment? Or even something as simple as thinking about clinic times, right? Clinics tend to be open when you are in school. Is there enough time, even if everything is working out, for you to leave school and get to the clinic and get the care that you need? Those are all different barriers that young people are having to navigate, in addition to just getting access to healthcare. Another area where I've really kind of seen a trend in whatever policy is happening on a state or a federal level is with our repro kits. So anyone that's not familiar, Jane's Due Process offers free and confidential reproductive health kits, basically. Our kits include 2 emergency contraception pills, 2 pregnancy tests, a handful of condoms, and an informational zine that talks about how to use everything in their kits and kind of some local clinic options that might be available to them. And we found that this has been a great way to kind of connect young people with the resources that they need. So in 2023, we saw that across our 4 cities that we are in at the time, we delivered about 2,000, a little bit above 2,000 kits. In 2024, we saw that increase to 5,000 kits across the 5 cities that we were in at that time. I was just doing the data recently, and in March of this year, we're already over a little over 1,000, right? So you can kind of see as the policy gets more restrictive, as the landscape gets even more difficult to navigate, the need for a free resource, a confidential resource, increases. And that's just a small example of the cities that we're in rural Texas. And so I think when we are trying to have meaningful conversations like this one about young people's access to contraception, something that I think is really important for us to bear in mind is that oftentimes young people know the things that they want to access. They just need a trusted adult in their corner to maybe help guide them through that process. And for a variety of reasons, that trusted adult may not be their parent. We see that a lot on our text line as well, since one of the services that we offer is emancipation referrals. And we'll see that maybe the young person doesn't live with who their legal guardian is. As Carrie was mentioning, maybe their legal guardian is experiencing misinformation themselves, or isn't on board, or is incarcerated. There are a variety of reasons why the legal guardian for someone is not the same person that might be able to consent to them accessing contraception. It may also not be safe, right? If a young person is experiencing abuse, I highly doubt that the person inflicting that abuse on the young person is then going to consent for them to access contraception. So how do we walk this line of ensuring that young Texans get access to the healthcare that they deserve while making sure that they are supported? And I think on a community level, what I've seen from the volunteers that reach out to us, what I've seen from community events that we've hosted, is ensuring that we can become that trusted space for young people. And when I say we, I mean, of course, in my context, I'm speaking about Jane's Due Process, but I also think it's anyone in this room, right? If there are young people that you come across who you can be a trusted space for, I think letting that be known is a great way to ensure that they know who to turn to when they're in need, instead of having to figure out how do they get to the clinic or how do they get the information that they need. And I've seen that again happen on the text line and the hotline time and time again. One of the things that we'll ask young people after they've requested a kit from us is, hey, how'd you hear about us? We get a lot of, my sister told me, or my cousin told me, or, oh, someone posted about this in a Facebook group, right? So there are a lot of different ways and a lot of different touch points that young people come into that can kind of serve as that trusted entity for them. So that's definitely something that I have seen happen on the text line. I've seen happen with our repro kits time and time again. that idea of young people know what they want to do, they just need the ability and the support to actually access it.
We're going to open to questions in just a second, so get ready. Your last sentence was like my takeaway from all of this. So teenagers are having sex regardless of what we would want or tell them to do. They want to be safe and they kind of know how to, but there are some barriers in their way. And I guess I'm really curious, and I wish we still had Senator Cook with us. How do we communicate those basic facts to lawmakers in a way that it's like, you can want parents to be involved, you can want them not to be having sex, but that's not actually what's happening in the real world, and we could do better by these young men and women. Maybe that's a rhetorical question. You all get ready with questions in the audience.
I can actually speak a little bit to that. One of the programs that we have at Jane's Due Process is our JDP Youth Fellows. So these are former clients of ours who have decided to come back to support JDP and to serve as a voice for young people. And I think when we're thinking about who to speak on behalf of young people, who best than the young people themselves, right? Research often shows that we tend to learn better peer to peer. And so our youth advocacy program is one of the ways that we have allowed space to train our young people to be advocates, to be sex educators in their community, and to kind of be that voice to legislators to say, hey, we're here, this is what we're going through. We're not just like amendments that you can make in legislation. These things impact us. The data shows that, their anecdotes show that. And so I think uplifting young people's voice is definitely one way that we can do that too.
Well, and the senator certainly said, come down and testify, tell your story. Audience questions. Go ahead.
Could you fill in some background about why CHIP doesn't cover contraception, as well as why so few people are covered by it still?
I don't know the policy history about why it doesn't. I mean, every state, they create they create their own Medicaid programs, they create their own CHIP programs. CHIP in particular is a program where states have had a lot of leeway in terms of how they want to do carve-outs for that, who's eligible, up to what limit, and what services are covered. So I don't know the history about why contraception isn't covered there, but for the longest time, Texas has been a state that has not covered contraception in its CHIP program. And in terms of the reasons for the decline in enrollment, I know that that's something that's just been happening over the last several years. I don't know how much of this may be related to just some of the pandemic unwinding that's happening. And I don't know, maybe if you've seen any differences in your clinic that you can speak to what patients and parents report.
Yeah, so not specifically for CHIP, but I will say even for Medicaid, the process has become, just with like everybody being kicked off at a certain point and then having to re-enroll, that by itself is a really difficult process. For one of the state programs, the Healthy Texas Women program, a couple of years ago, what happened was they changed their application form, and this happened not through any legislation. I believe this was more like an administrative change, and the form went from being a couple of pages long to being like 7 or 8 pages long, and included really complicated information that a lot of people don't know. Asking about parental income, and even an 18-year-old might not know the answers to some of these things. And what we noticed was that in our clinic, while we had approximately 30 or 40% approval rate for the people that we helped them apply to Texas Healthy Women it went down to less than 2%. So, and that makes a big difference to clinics, right? So if you're not getting reimbursed for our care, how do we provide free care to these youth? So, so sometimes it's like I can't speak to CHIP specifically, but one of the reasons for decreasing enrollment is just because people are not getting approved for this, rather than them not qualifying for the program.
Yes.
My question's beyond the contraception. Ectopic pregnancies seem to account for 1 or 2% of pregnancies worldwide, including presumably Republican pregnancies. can a woman in Texas who has an ectopic pregnancy, and there must be several or more than several, can they get health care in Texas now?
Yeah, so again, this goes into the lack of, clear guidance on what constitutes a medical emergency. In most situations, an ectopic pregnancy would constitute a medical emergency and would require urgent management. But I think what we hear about is that sometimes there is that ambiguity in situations where people are like, oh, is this truly an emergency, and can this qualify for a abortion or a termination as against not. And do you have any further like JDP related things that you want to have?
Yeah, I don't know if I can speak specifically to ectopic pregnancies, mostly because we try to serve more as a resource than offering medical advice. But one thing that I can speak to is that very gray area and how that can often lead to questions like, can someone still access healthcare service, right? What does that look like?
Yeah.
And I will often say that if you as an adult are struggling to make sense of what the legislation is, I can only imagine then what a young people is also experiencing, trying to then also make sense of that. And then also, where are they getting their information, right? And that's not necessarily to say that young people are inherently accessing misinformation, but it's more so to say, like, have we created the avenues or the spaces for young people to know consistently where they can access reliable information to help answer some of those questions?
Yeah, and there's a lot of confusion in providers as well. Like ectopic feels like a more black and white situation, but there are lots of other areas of pregnancy complications where the provider is not sure.
I can imagine, just to broaden this, the most capable young women who ought to be working at Rice University or studying here say, I think I'll just give it a pass because I feel safer in New Mexico or Colorado or New York or Massachusetts. There are other repercussions. Yes, you could die, but also I don't think it's good. It's not a good optics for the state of Texas to be behaving in such a way and limiting women's access to health care.
We had a great panel here last fall on the topic of the impact of the abortion bans on the OB-GYN provider supply in Texas. And it wasn't about patients, but it was about providers saying in this uncertain environment, applications for residencies were down, and OB-GYNs were retiring earlier and considering moving out of state because of the concern about how do you take care of a pregnant woman who's in an emergency situation when the law is so vague and you have state officials who will go after you. You can go find it on the website and under past events.
In addition to that, last year the Texas Medical Board, because of the request of people, they had to somehow do a clarification for doctors to know what the process was to gain an emergency abortion in the state of Texas. Because the thing is that doctors have to go through thousands of steps, but they have to go through multiple channels in order for them to get an approval for someone to access an abortion. So one of my abortion storytellers actually gave birth, but because her placenta was stuck inside of her uterus, she had to wait more than 2 hours to get care to get that placenta out. And because of that, she suffered complications in her pregnancy. And this is her giving birth like 4 months ago. So abortion is a lot in Texas right now. It's horrible.
There's some bills trying to make some improvements. We will have a Baker briefing, our podcast, on that in a couple of weeks.
I actually have a question, sorry. I'm curious about if your research also included the research in PCOS or endo for teenagers, since we have been seeing an increase in them.
We did not look at that in our research. We were just specifically interviewing teens who had reached out to the JDP text line looking for information about contraception where they didn't have to involve a parent. So we didn't explore any of their other reproductive health concerns specifically in that project. But that's a really great point that, you know, these are some other areas where young people need, where contraception could help young folks who are experiencing those other kinds of health problems.
The reason I was asking that question is because when I was a teenager, I'm first generation Mexican American, and when I ended up starting to get my menstrual cycle when I was 15, my period used to last 3 weeks out of the month. And so I needed to access birth control to be able to regulate that. But because of the stigma that was between birth control, my mom just kept denying, even though the doctors were like, your daughter needs this. So then I had to wait until I was 18 years old to be able to go to my local Planned Parenthood to be able to get access to health care just to be able to help me. And so when I do educations or teach-ins, that's one of the things that I like to look up to people is birth control has multiple purposes.
Yep, absolutely.
Go ahead.
First, I can speak to what you asked about young women leaving the state. I'm a medical student.
Can you
across
speak
the
up?
street. Hi. I can speak to his question about young women leaving the state. I'm a medical student across the street, and I chose to stay in Texas, but a lot of my friends didn't. And that's complicated. There's a lot of reasons to stay, and there's a lot of reasons to leave, both on a personal and professional level. I imagine I will leave for residency because I cannot get the complete training to be an OBGYN in Texas.
Wow.
But, and I have a lot of friends that, you know, they just matched, and that's the decision they made. One of your former research assistants is my friend,
Oh,
Dr.
nice.
White, yeah. And so she told me to tell you hi. I'll find you later. But
Awesome.
that's very real. There are also people who choose to stay because we think that we can make change here. And I appreciate you thinking of it, but I just wanted to raise that it's
Thank you very
it's nuanced.
I'm glad you're here. I'm sorry we can't keep you under current circumstances.
Hopefully I'll come back. That's the plan. But question for y'all on the panel, and I'm not sure who I have a question on emergency contraception specifically. I think it was your slide, Dr. White, that it said, like, can teens, question one, can they access emergency contraception over the counter?
Yes. In theory, they can. The FDA did not put any age restrictions on emergency contraception when they made it available over the counter. Now, whether or not young people who go and purchase that run into barriers at the point of purchase is a different situation. And certainly they do. I mean, emergency contraception is sometimes behind lock and key, or it's in a special plastic box that you have to get, you know, someone on the staff to like unlock it from the special box, like you might have to, you know, razor blades or things like that. So there are other barriers that can get in the way that, you know, just make it more difficult for young people, or they just may, you know, get a little extra scrutiny when they walk up to the cashier to get the method. But according to the FDA, there are no age restrictions on purchasing emergency contraception.
So where my question comes in is, does that change if they're in the hospital? Because I'm specifically imagining minors who have just experienced assault who show up in the ED, and maybe you can answer this question more. Because if it's provided by a clinician, do the rules change, or can they receive that no matter what?
Yeah, and you know, that brings up the context of like, is it a prescription or at this point, right? Versus like, you know, is this something that the minor is buying on their own? I think it depends on the hospital and the policy of the hospital. So, you know, you really need to be, you really need to be very clear about your hospital's, recommendations around that. But for the most part, like, it is truly over the counter. So as long as a young person wants to go and purchase it, it's okay. Now, this is only for like levonorgestrel or Plan B. There is a different type of emergency contraceptive called Ella or Ulipristal, which is a prescription method, and that requires parental consent because at this point it's no longer over the counter, and that is more effective. So, you know, the more effective emergency contraception is not available.
Yeah, that's a really great point. Thanks so much for mentioning that.
And the whole irony is that it's easy to get stuff that doesn't work, and it's really hard to get stuff that works.
Yeah.
Anyone else? Final comments from any of you?
There's one more question.
Oh, I'm sorry. Go
Going
ahead.
back to the contraceptive coverage and access, is this a general across the state of Texas? Is there a specific way to see ethnicity backgrounds? Or a breakdown on it?
Oh, I don't know off the top of my head, but yeah, there are definitely differences in, you know, who is enrolled in Medicaid or who is enrolled in CHIP, who the uninsured are in Texas. There are definitely differences. I don't know, you know, I think as we see in a lot of other states, that, you know, it is largely the folks who are uninsured are often coming from communities of color, and I don't have the specific breakdown of what that looks like in Texas off the top of my head, but
The numbers were high. I was just impressed. They were really high.
All right, going once, going twice. Thank you all for really digging in and informing us and our audience on this seemingly simple but really complicated topic in terms of how we take care of our teens. Appreciate you. Thanks for being here with us today.